Hi everyone, Garrett Murren here, and today we're going to look at another brief case report. This is a case of a stroke resulting in headaches and a loss of visual field, and was kindly submitted by Dr. Larry Wallace. For medical history, we have a 68-year-old female with early glaucoma, high blood pressure, heart disease, and diabetes. The start of care symptoms and findings, well, she'd had a stroke 5 months prior to the start of treatment, resulting in the headaches and the loss of visual field. Now, what exactly do I mean by loss of visual field? It means she had a blind spot in her field of vision corresponding to where the stroke occurred. And as you can see here in the picture, she lost the left side of her visual field due to a stroke on the right side of her brain. And if we look here at this diagram, you'll notice the area indicated by the yellow circle is going to correspond with this area of the brain. And see how the right nerve pathway to both eyes is affected. And if we look now from the side, this is the general area the stroke occurred, and this is where treatment was administered. Now with treatment, there are 12 treatments done in total, once per week, in the office, and the treatments were 5 minutes, scanning at 50 Hz on both sides of the head. And this is indicated here by these three yellow arrows. And in addition to this, there was 5 minutes at the site of the stroke, and as you can see here, this is indicated by the yellow circle, also at 50 Hz. And this treatment is adapted from Neurology 3 on pages 214 and 215 of your user's guide. And now to touch briefly on the rationale behind the stroke treatment. We have a synergy of the coherent multiradiances, meaning, as you can see here in the illustration, the ultrasound, magnetic field, infrared laser, and color LEDs operate together, and their combined general cellular effects are illustrated. And today, for this case report, we're going to touch on two of these in relation. One is ATP synthesis, and the other neurochemical messaging. And because stroke results in a major loss of cellular energy stores in the brain, it's regarded as a big energy deficit. And you can see here, if we relate this to a fuel tank, when the energy fuel tank is full, this is good health. And the lower the gauge goes, the worse the headache symptoms become. And so it's no surprise she suffers from headaches after a stroke. And because of this energy deficit situation, the treatment with the delta provides the body support in restoring and improving the energy levels. If we look at this transcranial laser treatment, restoring ATP levels after a stroke, this is from Lapchak in 2010, not coMra therapy. And as you can see here in this graph, the vertical line to the left indicates the ATP levels or the energy levels in the brain. The far left bar indicates highlighted by the yellow, is indicating that this is the before the stroke or healthy levels or normal levels. Next we have the lowest energy levels, and this is after the stroke. And following on from this, we see the transcranial laser treatment results. This is no drilling holes or anything, just touching the skull with their first laser applicator. And there's a major increase in cellular energy stores. And the same, only more, with their second applicator. And as a result of this treatment, ATP levels have increased 77% relative to pre-stroke levels. So laser therapy not only restores ATP levels back to normal, but also increases them beyond normal levels. And so this is critical in healing. If you look here, you'll see the heading indicates response of neural stem cells to chemical messengers on the left and infrared light on the right. In this experiment from Anders in 2008, the neural stem cells are grown in a petri dish with chemical messengers or growth factors. And that's on the left-hand side. This is like what happened inside the body, provided it's got the energy and the resources to do that. Whereas on the right, the neural stem cells are grown with light alone instead of growth factors. And you can see here they're doing very well with the application of light. I'm pointing this out because not only is the body being supported to increase cellular energy stores with the delta's application, it's also being supported in the regeneration process as well. Remember the rationale behind the treatment. This is the neurochemical messaging aspect. Now that we've touched on the rationale, let's have a look at the results. With the final progress check, there was testing done and the visual fields were completely restored. So a full field of vision once again, and the patient reported the headaches now much less frequent and much less intense, and most likely, in my opinion, due to the increased cellular energy stores. And this is with 12 in-office treatments. The attending doctor in the case reported the results as a substantial improvement. And the patient, well, she's very happy in this case. Thank you, everyone, for your time and attention, and a special thank you to Dr. Larry Wallace. We'll see you next time. Bye-bye.